We have the T-cell acute lymphoblastic leukemia. So you will know that it is not just some of these Philadelphia chromosomes, abnormalities, and others. You can also look at notch in leukemia, look at notch in breast cancer, cervical cancer, colorectal cancer, even down to what? Ovarian cancer. We have the comparing hedgehog and notch. You see the future signals. We have the SHH, the jagged notch. We have the main receptors. We have the transcription, the major congenital disorders, and major cancers. Here in major cancers in hedgehog, like I did, was basal cell carcinoma, and the other one, T-cell acute lymphoblastic leukemia. But that does not mean that you cannot explore as a researcher to look for it in another kind of malignancy. Next slide. This is a schematic representation of signal sending cells, explaining the notch and the hedgehog target genes in the signaling pathway of notch signaling pathway, hedgehog signaling pathway, and WNT signaling pathway. At the end of this presentation, we should just be encouraged to study different kinds of pathways. And as we are studying them on our own, let's filter out as much molecules as much as possible. Know what we can sign off for. Next slide. This is also the beta-catenin pathway. Next slide. Now, the crosstalk between developmental pathways. How beautiful network figures. The hedgehog notch, WNT, the TGFB, this P13K, and then mTOR. Some of these are involved in so many cancers, especially this P13K. People are beginning to notice that some of them that overexpress this mutation of P13K can be responsible in a reason why what was working before is no longer working. You begin to give an answer to it. Next slide. When in all of this, the whole idea of all of this is leading us towards precision medicine. In all of the molecular signatures, the molecules that we're signing for, and how they are related to what? To cancer, is to lead us to a treatment. If there is a known molecule, and that molecule is responsible for a particular cancer, then it should drive us towards a remedy, a proper treatment in the field of what? Precision medicine. Next slide. These are areas for current researches, cell signaling, sequencing, the spatial transcriptomics, the AI-associated pathology. The AI in pathology now is gradually taking up a lot of things. Just like AI is making people lazy to go to. I just pray that AI in pathology does not make people lazy. The organoids and the lipid biopsy. These are current areas of research that we can work with respect to signaling pathways. Next slide. And then I have a case study I want to show you. It's a patient with 30 years old albino patient. Diagnosis was done to the squamous carcinoma. That is, there is basal cell carcinoma and squamous cell carcinoma put together. We can discuss it, diagnosis, molecular testing, targeted testing about them. Next slide. Now you see what we saw. For instance, if you look at this, these are skin. The one on your right is a skin with melanin, melanocytic skin. The other one does not have skin, right? And we know the role of melanin. When there is UV light hitting the skin, where there is melanin, it tries to prevent insult of the UV light on the cell. But where there is no melanin, the insult becomes faster, and you can now begin to fall sick as a result of the cancer. Before now, please remember that this hedgehog signaling pathway or other pathway, sometimes and the disease they cause, are not just standing alone. There is a firm relationship between cytogenetic abnormalities. In context, can also be related to some of these pathways that we are studying. So you can see this one, there is no melanin, the other one has melanin. And so because of the UV light, especially for albino in that case that has been introduced. Next slide. We notice that there can be cancer. The first one is basal cell carcinoma. The second one is also basal squamous. It has some level of basal formation. And usually basal cell carcinoma is localized. The plastic surgeons know how to handle it. And then, but when there is squamous cell, they also use other drugs, chemotherapy drugs, or targeted therapy drugs for them. And so, in the context of molecules, in the context of precision medicine, and in the context of H1 signaling pathway, what molecules can we apply? And what precision therapy will it lead us to? Next slide. If you look at this slide, in basal and basosquamous cell carcinoma, because of the cancer as a result of what? UV light, we now have cancer, and we decided to apply what? A molecule. And in this case, what we apply is the sonic hedgehog molecule. The sonic hedgehog molecule involved in which pathway? The hedgehog signaling pathway. That was what we did. And after doing it, it was discovered that there is an overexpression of the what? The sonic hedgehog molecule. Taking advantage of this overexpression of hedgehog signaling sonic hedgehog molecules, there are theranostic applications. The theranostic application now is the targeted therapy. Theranostic application of drugs that are given, considering the fact that the sonic hedgehog molecules were detected in the cancer. There are other molecules. And following other molecules, there are other treatments. So, applying this, we have seen overexpression of sonic hedgehog and drugs. Next slide. And so you see overexpression of hedgehog molecules leading us to a targeted therapy where the drug vismodegib was now being used. In addition to the surgical intervention that the plastic surgeon did, he would be doing it together with this drug. How did this drug come about? The drug came about because we relied on what? A molecule in which pathway? The hedgehog signaling pathway that is giving us a targeted treatment in precision oncology. So, sign a molecule today. Next slide. And the clinical relevance for these healthcare professionals: early diagnosis, molecular pathology, genetic counseling, precision medicine, drug development, and personalized oncology. These are things that are very, very relevant as healthcare professionals. And who are healthcare professionals? All of us that are seated here are healthcare professionals. I just sent this link. We must look into what is clinically relevant and begin to think on how we can take advantage of this clinical relevance. When they say this and this is relevant, do we keep quiet? No. Do we ignore it? No. We should take advantage of them and then apply them for use. Next slide. And so these are future world perspective. Like I mentioned before, AI is now coming out in number one. I don't know, these AI people. And then the multi-omics, the gene editing, personalized medicine, developmental therapeutics. These are future perspectives. Now, what our take-home messages that I want you to go home with, even if you have not listened to me very well, just take-home messages. Developmental pathway regulates what? Embryogenesis. It's a stage. It's a stage. If you look at the seminiferous tube, it has about 4 or 5 layers, starting with the primary and secondary spermatocyte, the spermatogonia, the spermatids, finally even to the maturation of what? The sperm. So when you look at a seminiferous tube, instead of seeing 5 or 4 layers, you are seeing 2 layers. Does that show development? Development is hampered with. And so you must also look at tension and notch are highly observed. This regulation causes congenital disorders. These congenital disorders, like we have seen, can be of various types. Birth defect of different areas, face, hand, brain, even up to cancer. Same pathway. You see, same pathway also do what? Drive what? Cancer. and the molecular understanding enables targeted therapy. Right. Next, that is all. Please, as you ask your question, don't ask me difficult question, please. If you ask me difficult question, I will invite you to Golden Lupis, where we will stay in the garden. We will begin to answer it there. Maybe when you take one bottle or two bottles, you will forget the question. God bless you. I don't know. I think I need to talk to our university. Why you are not the professor? Your publications are not enough. We can talk to the management of the institution, frankly speaking, because this is a professor. This is a professional presentation. Prof, am I not speaking your mind? Yes, sir. Yeah, exactly. Let's put our hands together. When you started, I had a lot of observations because I was almost paying attention more to the knowledge and the lecture, but I think I got my clarifications along the line of presentation. Thank you so much. So we have some comments. Some comments, some questions.
Thank you.
Some comments. Yes. Introduce yourself. Yes. I want to count one more time. I have one there, yes. I don't want to speak based on what another person said. Let us speak to the presentation. One. Any other person? Two. Okay, three. Can I get the last person? A female for the fourth person. It's like we have a story. Yes. All right. So yes. Introduce yourself and let's have your comment.
My name is I'm a student embryonic development to congenital cancer. The question should be some days back. I and my colleagues were talking about chimerism, tetragametic. So I had a question in that regard to ask if the H4 or notch signaling plays a role in that kind of chimerism, especially the part where one twin is absorbed by the other when development is taking place. Thank you, sir. That's the question.
I hope you are picking that soon. I want to take the three questions in succession. So who will allow us to close the debate. Where's the number 2 person there? Yes.
Yeah.
Okay, sorry. Introduce yourself.
Well, yes, thank you. It is the morning of the I can.
I'm impressed with the lecture of our own trailblazer as far as cellular pathology science concerning this country. So I just want you to throw a light in the notch molecular signaling pathway in breast cancer. I have interest in breast cancer research. Thank you.
I'm not going to speak for him, but that's another topic for discussion, and I have a prelude of that too. Yes, your comment, sir.
Thank you. Since our presenter has already bribed us not to ask a question,
No, I said difficult question. Difficult.
I will say it's not a difficult question. Our presenter opened my eyes to another dimension of research, and I want to thank you very much. That the take home for me today is that some of these molecules to be expressed using many of immunohistochemical methods, just like the case study you presented, where the Hedgehog was expressed on that scale. Mr. Presenter, thank you very much. Just for because this slide at the end we're going to share and we go over some of those photomicrographs there. This was the one you sent earlier after the corrections you can make so that those photomicrographs you can indicate, label them properly, put the notifications, some footnotes to enable us the simple question is this.
They would
Are
also
local alternatives to immunohistochemical studies that one can explore in targeting any of these biomarkers? Thank you.
All right, local alternatives. All right, that brings us to the end of the audience. Okay, Doc, Prophet,
Yes, sir.
All right.
I want to start by saying that all the questions are difficult, so we'll meet there. But however, I will just give you the address on how and where we are going to meet. And the address is starting with the first person when the question was asked. The simple answer to your question is yes. Because embryogenesis is a complex procedure, a complex process. And in that process, when it begins, it starts with the molecules taking in mind that look, it's going to develop every cell, and all these cells are going to develop to form organs, and then finally to a complete human. And so, in all diseases that may come up to it, as long as hedgehog is involved, the answer is yes, that it plays a role in that situation. And then to the second person, notch in breast cancer. The truth about it is that as a researcher and as a scientist, everything is possible. Very, very possible. If you check researches that is done in Nigeria, I don't know how many people that have done hedgehog signaling pathway. A lot may have done critical review and the rest of that, or any kind of review. But real research work, very few people have done it. When I did what I did in Nigeria on skin cancer, even before I started publishing it was like almost like 3 years. I've been going through literature to see if there is any person that have done similar work, but still none. And just like the keynote speaker was talking and saying, Nigeria, you use your money to do research. So you can imagine people that will look for money to go and look for one molecule that he doesn't know where he will get it, and even if he finally get it, I don't know how much that you will be told. So expensive. However, the notch hedgehog signaling pathway is highly encouraged, and I want to believe that if you get a very good one, I refer you to Ventana Roach antibody of notch, and there's one other company, if I remember, I will let you know. Taco. These two companies have very good notch antibodies. If you want to go molecular, apart from buying the notch antibodies, you can also buy the notch probe and primers, so that as you are detecting it by proteomics, you are also looking at them genetically what is going on, and depending on the breast cancer. As we speak, honestly, if you carry out that research, you get good quality breast cancer from the archive of any institution. You might be causing some insight that will make a lot of people to start citing your papers, because it might be a new thing that you are now detecting notch gene expression in our breast cancer in Nigeria. Especially if you do it in triple negative breast cancer, where people are looking forward to see other molecules that can be useful. So do a notch expression gene profiling in triple negative cancer, and you will remember as about 2026. God bless you. Are there local alternative to for ISC test selling? Well, the truth is that if there are really local alternatives, a lot of people, as I speak to you, within the last 2 years, because of economic situation in Nigeria, the number of people doing immunohistochemistry, Prof. Imagine, you agree with me now? INC people don't even come to do it again because of what? The cost. Antibodies and detection things have gone so far. Even patients are not even coming to pay for it, let alone research. Research do themselves, the money because of cost. And so, what is it that will even be locally? When you talk about local, what is it that can be localized? The antibodies may not even be localized at all because our capacity for antibody production locally is very poor. However, what you can think to adopt locally could be the detection what? The kit. Among the detection kits, personally, for those that I have trained in ISC, I have constituted a lot of local components within the spectrum of detection kits to make life easier for them and to make costs with antibodies. It is still, I'm also on my own working on it, the ability to produce direct oil. I think that's all. God bless you. But we will still answer the remaining questions there. Thank you.
Can we put our hands together once again for Dr. Jonathan? Dr. Joe, you have you created a very wide margin. Please, the responsibility table, you could just come back to your seat. Let's close formally for today. Please go back to your seat. Okay, sorry. You created a problem. And that problem, yes, you created a problem, and that problem is beyond many of the people sitting here. That is the real dichotomy between practice and academics. And I'm going to discuss it with you on the other side, not here. I want to appeal to most of our presenters today, particularly those in academics. Beautiful presentations, but the reality on ground within our laboratories, our health facilities, we must match them with our experience in the field. Having said that, let's appreciate him once again. We want to invite our national president of the SCPSM, please, and the presenter, please come this way, sir. Our presenters, please, Dr. Jonathan, Professor, okay, our keynote presenter, please come to the stage. Please, sir, please come to the stage. Where is the representative of the council? Our council representative, please come to the stage. All right, so we'll have a photograph to mark today's event. Our chairman, sir, please join us. Yes, please join us. This is where I was wondering whether our females actually escorted us to this conference. And tomorrow, I want to see a change. Not true. Women don't do. All right, thank you so much. Yes. Please, we will close. Let's close formally, please. We don't need to separate. Let's close formally. All the national executive members. Don't forget more photographs tomorrow. National executive members here present, please. All national executives, please. Well, our state school. I know I want to be selfish with Delta. The state school Delta, what are they? They are not here. National executive officers here present. Any other person? Any state chairman or state secretary here? When they enter, we can reduce. That, let us close formally so that photograph can continue endlessly. Please. Yes, please. Please have your seat for just 2 minutes. 2 minutes and we'll be done. At this point, let us invite Sir Bernard for information and announcement.
Thank you, Mr. FC. So tomorrow we are going to start very early by 9. Please ensure you are here by 9 tomorrow. We'll take our presentations tomorrow. It's going to be a long time of learning, sharing ideas and doing interaction tomorrow. Our scholars have a lot to do us here. And if you are a registered member, please ensure that you write your names at the reception desk. We are going to issue certificates after this conference. Please ensure that your name is there every day. Every day, always register and write your names. Thank you. And for this one, registered members, don't be in a hurry to leave. Our AGM on Friday is very, very important. Make sure you are around. Thank you.
All right. Yes, my sister, please come. The lady stepping out. Hello. Please come. Just come. Formal vote of thanks for today's event.
Okay, standing on the already established protocol, love Economic from Federal University for Still Sciences. I want to thank Federal University of Tweke, Bayelsa State, Still Sciences. So I really want to thank the National Organizing Committee. It's been a wonderful time. The National Organizing Committee, to my Oga, Mr. Duro. I'm very excited to be here, and I really want to thank the society as a whole. Thank you for thinking of a platform where the societies can interact and bringing up this platform and then organizing these programs annually so we can learn and improve. Thank you very much.
Thank you. We started today's activity by community Togo Sound. The announcement has been made. We'll be here tomorrow by 9 a.m. Yes, madam. Madam, come. Hello. Come. Come now. Come. Come. All right. Mr. Chairman, sir, permission for us to close the event with a closing prayer.
Thank you for bringing us to this. We ask that as we are going back to the various places where we ask for safe journey, we shall go down and we any form of accident, we will ask
Thank you so much. Wishing all of us a very blissful year in Asaba, the capital city of Delta State. Enjoy your evening and see you all tomorrow.
You thank the MC. So, if you want to join the society officially, see the public secretary, Santa Colin Blessing or Simi. All those who want to join the society officially, see me at any time in this conference or the positive secretary.